A significant amount. In children who are thin or of healthy weight, the prevalence of high blood pressure is about 2 to 3% in the general population, whereas in children who are significantly overweight or in the range of obesity, that number rises to over 20%. And so about a tenfold increase. Most of the kids who come to see me for a hypertension evaluation have been diagnosed with elevated blood pressure by their pediatrician, either for a routine well-child check or sometimes sports physicals. Occasionally, so about 1 in 6, 1 in 7 of those kids are diagnosed because they have chronic complaints such as frequent headaches, and that led to the observation that they had elevated blood pressure. So there are a couple of different classes of high blood pressure that are treated differently. The kids largely represented by the overweight children have what's called essential hypertension, which is very similar to the blood pressure elevation that's seen in adults. And those kids, we usually start with lifestyle modifications type therapy, trying to get them to lose weight, alter their diets in a variety of ways with lowering sodium, lowering sugar intake. And if that's not effective in getting their blood pressure down to normal, then we move on to blood pressure medications. In contrast, kids with secondary hypertension, so high blood pressure due to kidney disease, heart disease, blood vessel disease, we try and attack the underlying problem. It depends on the family to a large extent. Many families will have a long family history of high blood pressure, folks who've had major cardiovascular disease or strokes, and those families are often in the office hoping to get some sort of therapy to prevent their kids from having the same problems that other family members have. On the other hand, most kids with high blood pressure don't have a lot of complaints, feel healthy, look healthy, and it's a matter of preventive health work to try and avoid those problems in the future, and they're a little bit less receptive often.